Section 2. The Solutions Part 1. Your First Line Toolkit. Alright, let's get to the most important part, what you can do about it. I want to start with the tools you can access right now. The non-hormonal options that are the first-line treatments for mild to moderate symptoms. First up, vaginal moisturizers. It's really important to know that these are not the same as lubricants. Think of a moisturizer like you would a daily face cream. You don't just put it on when your face feels dry. You use it regularly to keep it hydrated. Vaginal moisturizers work the same way. You use them 2 to 3 times a week, on a regular schedule, to help the vaginal tissues rehydrate and hold on to moisture. They also help restore the vagina's natural acidic pH, which improves tissue health over time. Next in your toolkit are vaginal lubricants. Lubricants don't add long-term moisture to the tissues. Their effect is temporary. When you're choosing one, please read the ingredients. Look for water-based or silicone-based products. Steer clear of anything with glycerin, petroleum jelly, or warming agents, because those can be irritating and even increase your risk of infection. And just a quick pause, if you're finding this information valuable and want to take real control of your menopause journey, please take a second to subscribe to this channel. My goal here is to create a space where we can have these honest conversations and empower you with credible, science-backed information. Section 3. The Solutions. Part 2. Restoring the Foundation with Hormones. Now, for many women, especially if your symptoms are moderate to severe, moisturizers and lubricants might not be enough to get to the root of the issue. They're treating the symptom of dryness, but not the actual cause, which is the lack of estrogen. So, let's talk about the gold standard treatment for GSM. Putting that estrogen right back where you need it. This is low-dose, vaginal estrogen therapy. It is the single most effective treatment we have for reversing the tissue changes of GSM. This is not the same as the systemic hormone therapy HRT, that's used for things like hot flashes, which circulates through your entire body. Local vaginal estrogen is delivered directly to the pelvic tissues in very tiny doses, using a cream, a small tablet you insert, or a flexible ring that stays in place. Here's the key thing to know. The amount of estrogen that gets absorbed into your bloodstream from these products is extremely low. Because it acts locally, it gets to work restoring the thickness, elasticity, and lubrication of the vaginal walls without having a major effect on the rest of your body. In fact, this approach is so safe that expert panels are now pushing for the removal of broad warning labels on these products, to really highlight their safety and separate them from systemic hormones. These hormonal treatments are game changers. They don't just put a band-aid on the symptoms. They treat the underlying atrophy, restoring the health of the tissue and giving you lasting relief from dryness, pain, and those related urinary issues. Section 4. Your action plan for relief. Okay, we've covered a lot. You get what GSM is, why it happens, and the incredible range of solutions out there. So, what now? How do you build your own action plan? First, start with the basics. If your symptoms are on the milder side, try a combination of a regular vaginal moisturizer and a high-quality lubricant for intimacy. Stick with the moisturizer for at least a few weeks to really see the benefits. Second, be proactive. The single most important thing you can do is talk to a healthcare provider. Now, unfortunately, not all doctors are experts in menopause care. Don't be afraid to ask your doctor, are you comfortable managing menopausal symptoms like GSM? If the answer is no, or you don't feel heard, seek out a menopause specialist. When you have that conversation, be direct. Don't just say you're a little dry. Describe exactly how this is impacting your life. Tell them, it hurts when I sit, or I'm getting UTIs all the time, or sex has become impossible, and it's affecting my relationship. When you quantify the impact on your life, it helps your provider understand how serious this is, and find the best treatment path for you. Ask about all the options, non-hormonal and hormonal. Talk about the pros and cons of each based on your personal health history. Remember, this is a team decision. Conclusion. The information we've talked about today is your starting point. The most powerful step you can take now is to become your own health advocate. Schedule that appointment. Write down your questions. Have that honest conversation. And please, think about sharing this video with a sister, a mother, or a friend. You have no idea who in your life might be suffering in silence. And by simply sharing this, you could genuinely change their life. Thank you for taking this time for yourself today.